I believe you already know that the NHS does not provide free circumcision, even if you are in the highest tax bracket. However, there are specific reasons that will make the NHS to cover the full cost of this procedure for you. And on this video, we are going to be discussing that. Good day everyone and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today on this video, I'm going to be sharing with you 5 reasons why the NHS is going to cover the full cost of circumcision for your baby. But first of all, what is circumcision? Circumcision is simply the removal of the foreskin. That is a simple definition for circumcision. The removal of the foreskin in a male child. Now, the second question is, what is foreskin? I'm going to be putting it in a simple term. A foreskin is simply a loose skin that covers the glands of the penis. Okay, when a child is born, it's usually not retracted, but as a child grows older, it can be retracted. So if at any age you decide to remove the foreskin, that is what is known as circumcision. There's something you should know about the NHS, and that is the NHS does not provide free circumcision for any cultural or traditional reasons. Yes, they can only provide free circumcision when there are medical reasons attached to it. There is no free circumcision because your culture or your tradition actually permits you to actually circumcise your child. But there's a free circumcision when there's a medical reason attached to it. Okay, so I'm going to be sharing with you 5 medical reasons why the NHS is going to provide that free circumcision. So the first medical reasons why the NHS provide free circumcision is phimosis. You may want to ask, what is phimosis? I'm going to be telling you, just calm down. Phimosis is when the foreskin is so tight and it cannot be pulled down. It cannot be retracted to expose the glands of the penis. You can see the picture showing on the screen. It shows that the foreskin cannot come down. It cannot be pulled down. And when it cannot be pulled down, that is a medical condition that needs to be tackled as soon as they can. Okay, then the second reason why the NHS provide free circumcision is known as paraphimosis. Paraphimosis is different from phimosis. In paraphimosis, the foreskin is trapped at the edge, the ring of the penis, in such a way that you cannot pull it up to cover the glands of this penis. This particular paraphimosis is a medical emergency because when it is trapped at that edge, at the edge, it can constrict blood flow. It can restrict blood flow to the glands of the penis, to the upper part of the penis. So that is why it is a medical emergency and needs to be done. At that moment, circumcision needs to be carried out in order to prevent unnecessary complications. The third reason why the NHS provide free circumcision is known as balanitis. What is balanitis? Balanitis is simply the inflammation, the swelling, the irritations of the glands of the penis. And this usually happen to uncircumcised men. Yes. And these balanitis are usually caused by yeast infection, but viral infection, bacterial infection can also cause balanitis. And you know it's not nice having a swollen, red, painful glands and the penis. It's not a good thing. So they have no choice but to actually carry out that circumcision at that particular moment. Then the fourth reason why the NHS carry out free circumcision is recurrent urinary tract infection for male child that have abnormal urinary tract. So for male child or male babies that have abnormal urinary tract, they might recommend carrying out circumcision to prevent recurrent UTI. The last reason I want to share with you is known as balanitis xerotical obliterans, a condition that causes a tight foreskin and in some cases also affects the head of the penis, which can become scarred and inflamed. So these are the 5 reasons why the NHS provide free circumcision. So if you don't have any of this condition, if it is not a medical emergency, if it is not a medical problem, you're not going to get a free circumcision with NHS. All right. So most times what we have to do, because usually it's the 7, the 8, we usually do the circumcision back home. We have to contact a private circumcision specialist, you can do a home visit, or you can go to their hospital to get it done, but preferably I like home visits. Okay, so that is what we do here in the UK. So on another video, I'm going to be sharing with you the cost of circumcision in the UK and also the aftercare I was given for circumcision in the UK. I hope this video is beneficial and I hope you enjoyed the video. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you, bye, and see you in our next video.